price of freedom is death. We're coming to get our check.
Everybody, thank you for coming back. I'm gonna try to switch up the intro. I know I say welcome back, everybody, and to get like straight into it, but you know, if you see me mix stuff up, you know, it is what it is. I'm gonna start trying to put out videos Friday night or Saturday night, preferably Friday night. I'm gonna try to put at least one video out per week, at least one, and that's gonna be Friday night around 7, 8 maybe. If I don't put out one Friday night, that's because I'm editing the video, and you know, sometimes with certain things it takes a process to do so. Plus I got school and work and a lot of other projects and stuff like that I'm working on, so I appreciate your patience and your support. The black community faces tremendous health disparities, and since this is the month of Breast Cancer Awareness Month, I wanted this video to be the first video I made this month. I wanted something about health to be the first video I made this month. I might make another video about health if you guys want me to, but I definitely wanted this to be the first one I made. I think it's important for black people to understand the dangerous situation that we're in as far as the health conditions that we have to face. Not only the health conditions that we're living with as far as the high blood pressure and diabetes and obesity, but as far as the racial anti-black targeting that we face in the medical field. I'm going to start with that because I do think all of those things link up together. I believe, based off of the evidence that I have for you here, you guys know I have it, I believe that black people have a bad history. Well, I don't believe they have a bad history, if they have a bad history, but because we have a bad history with doctors and with the medical field in America, it leads us to not trust them, to not seek their advice. Anything they say, we kind of take with a grain of salt, and that is good to an extent, and to an extent, that's not a good thing. So I'm going to give you guys examples of things that used to happen to black people to make black people conditioned to not trust the American medical system. The first person that I want to talk about in this video is an American physician named J. Marison Sims. J. Marison Sims was born on January 1813 in Lancaster. He studied in the medical field, and he is actually lionized in the medical field today. A lot of his research and his practices and experiments have given the medical field as we know it today a lot of advantages. There's been a lot learned from the things he's done. Unfortunately, a lot of the experiments and the things he has done has been completely racist and anti-black, especially to the enslaved black women of the time. Many of the experiments that he conducted were done on enslaved black women. Those women had no anesthesia at all because when he operated on them, he believed, and this was the racist ideology of that time, he believed that black people do not feel pain the same way white people do. So he would just operate on them without their choice. Of course, this was back in the 1800s, so, you know, they were slaves and they didn't have free will. He operated on them. He not only operated on adult black women, he operated on black children as well. I'm sure he's done many things to black men, but these are the main two things that bother me the most. Well, not that black men don't bother me, but these are the things that is most notable. He did it mainly on black women and on black children. He used to think that the black brain was insufficient to the white brain. He used to think that the skull of a black person would grow super fast to the point where the brain was not a normal size or the proper size it should be in comparison to a white person. So white people's brains were bigger. You know, the experiments that they used back in the day where they used to measure the heads and they would make a racist assumption that black people's brains are smaller, and that made us less intelligent because back then they used to believe that bigger brains means more intelligent, even though that is in no way at all the truth. No way at all does having a bigger brain make you more intelligent. And their thing of us having smaller brains, that's not even true. They had a bias because they were racist people, and he was a racist person, so he had a bias as well. Now, when he operated on black children, he would use a shoemaker to pry their bones to loosen their skulls. These are the things that he would do to black people. He did this for many years. say, his methods were questionable. They won't really tell you exactly what he just had some ethical, questionable methods. But looking at this stuff, he will operate on people without anesthesia, causing many people serious pain and conflict. Now, all of this research that was done on black people, is used to save lives today. So a lot of the modern day research that we have in the medical field is really from black people, because black people were the guinea pigs, and black people were oppressed, and black people were targeted. So black people were the experiments, and due to these experiments, due to the studies of these experiments, they've developed their medical research. So a lot of that is due to us. I just want to point out, because I almost missed this, but this guy is so lionized that he has a statue in New York City. And here's a picture of it. Okay, but moving on to the next person. Now we're going to talk about an African-American woman named Henrietta Lacks. She was born in Roanoke, Virginia on August 1st, 1920. So unfortunately, she had cancer. She had cervical cancer. Now, unlike many other cells, doctors found her cells very special, because normal cells, they die off and they reproduce and die off and reproduce. Doctors at this time was having a very difficult time experimenting and using different cells to test different vaccines and different cures and treatments and to study diseases, because a lot of the cells in the lab would die off in a few days. All of the cells would die off. Her cells was a very special exception, because her cells would just divide and divide and make more cells, and they wouldn't die off. So a doctor named George Gray took her cells after seeing the special capabilities that they had, and he created a line named HeLa. The HeLa line was so special because it was able to travel around the world and be studied by many different doctors, and it even went to outer space. A lot of cures, a lot of vaccines, and a lot of experiments and diseases were studied with her cells. Unfortunately, she did die at the age of 31 because of her cancer. These cells created many different cures and many different treatments, and has saved many people's lives even to this very day. Her cells are still alive to this very day. At the time of this video, we're dealing with a global pandemic, the coronavirus, known as the COVID-19, and her cells are probably what's going to be used to help get a vaccine or get a treatment for that. So shout out to her for everything that she has done. What's really messed up about this is that nobody got her permission to use her cells like this, or her family's permission. Now, her family unfortunately lived in poverty most of their life, and they didn't find out that her cells were being used until 1971. So these are the things that American society has done to black people, to make black people not trust them, to make black people weary of being around them. Now, I have another example that's probably more well known than the two I brought up before. So moving on to the 1932 Tuskegee experiment. So I'm going to try to be short with this. I'm not going to try to spend too much time with this, because I do want to move on to some other things, and I don't want this video to be that long. But I might make another video about the Tuskegee experiment in and of itself. But right now I'm going to give you guys a brief rundown so you guys can kind of understand what happened, the gist of what happened. So in 1932, there was a disease, a sexually transmitted disease called syphilis. They wanted to study syphilis so they can start developing cures and treatments and things like that for syphilis, because at that time, nobody had seen that they had found any cures or treatments or anything like that to deal with syphilis. So they went to Alabama and found 600 black men. 399 actually did have syphilis, and 201 didn't have syphilis. Now, when they went into the treatments, they didn't know exactly what they were being treated for. They thought that they were being treated for, quote, bad blood, which was a term used for, a person who was sickly, I guess. I've read a lot of stuff about it. I haven't found a solid definition of what they would consider bad blood, but bad blood was a term that they used, so that's what they thought they were being treated for. Now, the medical professionals had told them that there would be free health care, free meals, and free burial. Those are the things that drew the black men in and made them condone to do the study. Now, the black men didn't know there was black men who did have syphilis. They didn't know that they had syphilis, and they didn't know that they were being treated for it, or actually that they weren't being treated for it. The doctors experimented on them, and they left the syphilis untreated. Now, of the 399 men who did get syphilis, who did have syphilis during the beginning of the experiment, only 74 of them survived till the end of the experiment. Of those 74, their families got paid off. Of the people who died, their families got paid off due to a lawsuit that happened in 1973 when a whistleblower blew the experiment because it was supposed to be a secret thing where they were experimenting on black people, but that got exposed, and then they had to, sue and pay the family off. But of those 399 men, 40 of their wives got syphilis. They got syphilis because they didn't know what disease they had. They didn't know they could spread it. They thought they were being treated. They spread syphilis to their wives, and their wives gave birth to children, and 19 of those children had congenital syphilis. So these are the reasons why black people have such a hard problem trusting new vaccines, new experiments, new testing, new all that stuff, because we realize that everything the medical field has done to us has been to exploit us, to use our bodies and exploit us for their own benefit. Now I want to talk to you about the diseases and the things that disproportionately affect our community. So the first thing I want to talk about is actually heart disease. Heart disease is the number one killer of anybody in America, and this goes all races: white, black, Hispanic. Hispanic isn't a race, but white, black, Hispanic, Asian. Heart disease, okay? Now, as heart disease is a problem, heart disease has steadily been going down since the 1970s for white people, but it has not so much been going down for black people. Black people are least likely to survive heart disease than any other race. So I'm gonna give you guys some numbers, but this isn't to discourage you. I want you to take this information and I want you to use this and apply your diet and exercise to counteract these things, so these things don't bother you, because we're disproportionately affected by a lot of these things on this list. But let's continue to high blood pressure. High blood pressure is actually a difficult thing to live with, and a lot of black people face it. Actually, according to the statistics, 1 in 3 black people actually have high blood pressure. So it is very important for us to make sure when we're young, because a lot of the times it affects us when we're young, at a young age. So when we're young, I know our bodies feel like we can take a whole bunch of, unhealthy dieting and not exercising because we're young and our bodies can handle it. But unfortunately, our poor diet and exercise actually does catch up with us into our adult life. Even before so, as a 18-year-old and 19-year-old, you're an adult legally, and you're an adult mentally. Maybe sometimes some people are not really adults at that age. Some people really don't ever grow up, but that's neither here nor there. But what I mean to say is, you're an adult, but you still have a very youthful, strong body. So your body can probably take a lot of things. Your body can fight off a lot of illnesses and a lot of diseases that it couldn't do 50 years later. But those things do stick with your body if you don't change it at this moment now. So when 50 years go by, you have a whole bunch of medical problems that have caught up with you because in your youth, you were not mindful of the things that you were doing to your body, which is poor exercise or lack thereof exercise and poor diet. Now, I'm not saying this to say don't eat anything, don't eat no junk food at all, go vegan, drink gallons and gallons of water. I'm not trying to tell anybody to do that. I'm not trying to say work out like you're some type of bodybuilder or some type of fitness trainer. I don't do that. I do work out and I do eat healthy, but if you catch me eating a slice of pizza, I don't want people to say, oh, he lied, he's eating a slice of pizza, he's not talking about health. It's okay. Eat your slice of pizza, eat your, slice of cake or whatever you like to indulge in. Just do that with moderation. Just do it with moderation. You don't have to work out 10 times a day. You don't have to look like Dwayne "The Rock" Johnson. But, you should, jog every now and then or take a walk or, do something to keep your body active, because the blood flow when you're young, even, as you grow up, you definitely should be keeping up with your exercise, because that's when your body starts to slow down, so it can't really fight off a lot of these problems like a younger body could. So that means you have to kind of compensate for that by making sure you eat a little bit healthier than you probably could in your 20s. In your 20s, you could probably eat a big plate of nachos every night for a month. You shouldn't, but you probably could do that, and it's not really going to affect you. When you're in your 40s, you eat a big plate of nachos every night for a month, and you're probably going to feel some effects by that. So you're going to have to be a little bit smarter. If you're an older person watching this video, you're going to have to be a little bit smarter with your dieting and with your exercise. And that's not to say if you have any medical conditions already, but this goes across the board. Whether you're young or old, you should have a balance of proper diet and exercise. You don't have to go overboard, but a balance of it. But let's look at some more statistics here. Cancer is the really, really big one, and the one I wanted to save till last, because this video is during the Cancer Awareness Month. I probably should have did it first, but I want to do it last because I kind of like to go out with a bang, kind of like to wrap things up really nicely. So I was debating, but that doesn't matter whether I was going to do it first or not. But anyway, cancer is the number 2 killer of all races in America. America has a very bad cancer problem. Cancer is not just breast cancer. I know this is Breast Cancer Awareness Month, but there's also skin cancer, lung cancer, pancreatic cancer, so many different cancers out there that a lot of people do need to be aware of. Now, a lot of research has been done as far as cancer, so fortunately, the rate of cancer death has been going down. The survival rate has been going up across all races, which is good. But unfortunately, black people are still disproportionately affected by cancer. Well, not so by cancer as to say we get it more, but our survival rate is not as high as other races of people's survival rate is. So let's look at breast cancer. Black women's death rate of breast cancer is 40% higher than white women's. That is terrible. Not to say that black women get it more, but the fact that black women die, their death rate is at a 40% level higher than white women. That's a problem. Now, that is due to a number of different things. That's due to poor medical care. That's due to some type of condition that we might develop due to, like I said, diet and exercise. That's why it's very important to take care of your body. I'm not trying to say eat seeds and beans all the time, but I'm trying to say make sure be mindful of what you're doing to yourself, and be mindful of exercise as well. Now, when I say the lack of medical care, I mean that to say doctors do not treat black women like they treat white women, the same as black men. Doctors don't treat black people in general like they treat white people, like they treat anybody else. So we have that problem, and we have the problem of conditions and stuff like that we might have due to our poverty. Black men are 50% more likely to get lung cancer than white men are. So you have black women and their disproportionate death rates when it comes to breast cancer. You have black men and our disproportionate rates of getting lung cancer. Both these things are very bad. Unfortunately, American society has proven time and time again that they don't care about black people. So it's really up to us to stay mindful, to make sure that we're caring for each other, which is why I really advocate more black people are going into the medical field, being nurses, being doctors and surgeons and things like that, because also statistics do prove that black people who are treated by black doctors have a higher survival rate. Black people who are treated by white doctors, you can look at the maternity rates and the pregnancy. When a black mother gives birth to her child, if they have a white doctor, then the baby is less likely to survive. It kind of makes me sad just to tell you guys that, honestly. This is just so, it boils my blood, the fact that our people are in this condition, but we have to be the generation to fix those things. We really do have to be the generation. So for all of my brothers and sisters out there working hard in the medical field, shout out to you. Please continue to do a good job. I'm going to support you as much as I can. I'm not in the medical field, but I do know a little something, and I will support you in any way I can. As far as the people who are trying to, get diet and exercise in the black community more and more, which is something that we need to do. Black people are in a state of our obesity rates, and this is another example. Our obesity rates are way higher than the white people's obesity rates. Are not just the regular obesity, morbidly obesity is higher in the black community. All these things need to be fixed. This video is kind of just a small little tad bit. I'm really not touching on anything with too much detail. I wanted to bring this all together to let you guys know, at the bottom line, we have to take care of our health, because all of these things that I brought up disproportionately affects black people. It affects us, and it affects our family members as well. So if you care about yourself and if you care about your family, you should try to reach out to them, try to get them to eat healthier, or try to do things to change their life and your life. Maybe you need to be the person leading by example of exercising, and then maybe that might inspire somebody in your family to exercise or to eat healthy. And like I'm saying, you don't have to go overboard with it. It doesn't have to be I have to eat all fruits and vegetables every day of my life. It doesn't have to be like that. You don't have to work out, do 1,000,000 push-ups every day. It doesn't have to be like that. But you have to have some sort of balance, because your life depends on it. I want to thank everybody for watching this video and staying to the end of this video. I want to thank everybody who's been commenting and liking. Unfortunately, this channel is kind of like under a shadow ban, I guess, because I see comments under the notifications, and then when I go to the actual YouTube video, the comment isn't there. There's some people sending me videos that the views of some videos are higher on their computer than they are on my phone or my computer. So I'm not really sure what's going on. I have a couple videos that's got like copyright issues, a couple videos that's got banned for, not banned, but they got strikes for violence, or I've never condoned any violence. I don't think I've never condoned any violence, but I've gotten in trouble. So they're after me, they're after your boy. So that's why I appreciate all of the support that you guys give. So if you like this content and you want to see more of it, which there will be a video next week, so you might want to subscribe and turn on your post notifications so that way you don't miss it. And you might want to leave a like so that way I know if you guys want me to talk about more medical stuff. And thank you guys. Thank you guys. I appreciate everything that you guys have done. I appreciate the likes, the comments, the subscribes, the recommendations, everything. It means a lot to me. It honestly really does. If you guys like this stuff, please let me know. I want to know exactly what subjects you want me to talk about, so leave it down in the comments. Message me. You can follow me on Instagram and Twitter. That way you can text me directly and let me know exactly certain questions or certain content that you might want me to talk about. Thank you guys.